So coronavirus has had a devastating impact on the cancer system, but it was actually overstretched even before the pandemic, not having the staffing it needed nor the resources. So that's why over 20 cancer charities have come together this week with MPs of all parties to say that when the Chancellor stands up in the spending review next week, he needs to deliver the funding to recruit particularly the staffing we need in the NHS in order to tackle the backlogs we're currently seeing, but also to meet the needs of a rising number of people who are going to be living with cancer in the future.
See, that's all very well saying he should just get the staff and everything, but they don't appear to be able to get lorry drivers or any of the staff that's needed. Where would you propose they get those staff from?
So this is about having a long-term plan.
Right.
Look, for example, Macmillan has analysed the fact that even before the pandemic, we had a gap of 2,000 cancer nurses. That's going to get worse. We've got 1,000 cancer nurses who are approaching retirement. And then, because of the rising number of people who are living with cancer, so 1 in 2 of us is going to have cancer in our lifetimes. That is a rising number. So when you've got a stretched system, people leaving because they're retiring, government needs a long-term plan. You're right, it's really hard to recruit people into the NHS at the moment, but we need a plan that looks at pay levels, training, ensuring that people who are skilling up in the health service have the space to do their training and their posts are backfilled. Because right now, NHS staff are at the end of their tether. They are absolutely exhausted. They need to know that the government has a long-term plan to recruit their colleagues who are going to help them, take the pressure off them. But in particular, if you get a diagnosis of cancer, you need to know that the people to diagnose you, treat you and care for you are going to be there.
How has it been then during the pandemic for most with cancer?
It's been awful. So Macmillan runs support lines with our nurses on the end of a phone. It has been incredibly traumatic to get a cancer diagnosis but then find long waiting times before you get your treatment, or to have disruption or delay to your chemotherapy or your surgery as a result of the impact of coronavirus. And Macmillan's analysis shows that we've got a backlog. So there are around 33,000 fewer people who've started their cancer treatment than you'd otherwise expect, which means that those missing people in the system might end up being diagnosed at a later stage, making their cancer harder to treat and decreasing their chances of survival. That has been traumatic if you've gone through a diagnosis and treatment. And those people and all of the public need to know that the government is going to back them and make sure that cancer services have the support and the staffing they need. So if any of us sit in a doctor's waiting room and get that news that you've got cancer, we know you're not going to face a long wait, you're not going to face disrupted treatment, and you're going to get the care that you need that helps you through that process.
So what is the average wait time? What was it before the pandemic and what is it now? If you get a diagnosis of cancer, what was it before and how much has it shifted?
So the government measures this in a few different ways, which is when you've got a suspected symptom, how long it takes to get to your GP and get to that diagnosis. So there are 2-week targets around that. But also there's a target around saying that from the moment of diagnosis through to treatment, you should start that within 62 days. And that's because...
That's 2 months.
Yeah, and that's really important because everyone knows that the earlier you catch cancer, the easier it is to treat and the better your chances of survival. Those targets weren't even being missed before the pandemic and they are way off now. And that's why we are seeing real anxiety from patients that might only get worse, particularly this winter. So we know through previous peaks of COVID that people have seen delays and disruption to their care. This year we've seen more people, which is really welcome, come forward with cancer symptoms because during the pandemic that's been quite low. So it's really important people always make sure they come forward if they've got a lump or a bump or unexplained pain or bleeding and contact their GP. But when they're getting into the system, there just isn't the capacity there. And as COVID rates rise this winter and as we face pressures from flu, we're likely to see those problems getting worse. So that's why the government needs to do 2 things. 1, make sure cancer services are protected this winter. So they've got the resources, maybe access to private hospitals to make sure cancer care can continue, but they've also got to invest in the long term. We're seeing there's 3 million people who are living with cancer now. That's going to rise to 4 million by 2030. There is no way we're going to cope and the system is going to cope, and we're not going to see longer waiting times or poorer quality care unless we recruit the cancer staff and nursing that we need.
And are people dying in the process of waiting?
So we don't yet know the evidence of that, but there is already some emerging evidence that fewer people are being diagnosed at the early stages, which is where we really want to catch cancer. And therefore, unfortunately, we will expect more people to end up even coming in through A&E because of the impact of their cancer on their health. That's the real worry. In order for the system to catch up, so we see fewer people being diagnosed at a later stage, but also so the system has a chance to care for those people who are being diagnosed at a later stage. That's why we need that investment from the Chancellor. The government has announced big amounts of money for the NHS, but we haven't seen the detail yet. So Macmillan, for example, has said that the Chancellor next week needs to announce a ring-fenced cancer nurse fund to make sure we get those cancer nurses. So we need to see the detail. Underneath those big numbers of money for the NHS, we've got to see what that's going to deliver this winter and in the long term.